Afternoon. Good morning, actually. It's not afternoon yet. Good morning. I'm Bethlehem, the Global Coordinator for Agenda for Change, and I'm pleased to be here to introduce the session on transitioning from basic to safely managed water and sanitation services, where we will be exploring the systemic drivers and implications for the transition. And this session is co-convened by RC Wash, London School of Hygiene and Tropical Medicine, University of Leeds, FCDO, and Agenda for Change. What will we be talking about for the duration of the session? We're hoping to cover a number of things. These are some of our expectations. So regarding the objective, we will be exploring the systemic changes needed to enable transition of basic water to safely managed services. We'll also be identifying the key drivers of the transition and explore strategies for facilitating the transition effectively and efficiently. And lastly, we're also hoping to analyze the challenges and opportunities for equity and inclusion in the transition. The flow of the session will be as such. We have actually a diversity of methodologies. We'll have the framing presentation from staff, and we'll have 5 pitches. And the pitches will really take home the objectives because they are diverse experiences that will give the objectives some texture and some life. So we'll have 5 pitches from different countries to inform the basis of the group work, and our 5 individuals who will be making the pitch are sitting at the front row. So they'll be giving you a very brief teaser or trailer version of what they'll be talking about, and they'll give you an opportunity to decide which group you want to be part of to learn more about their cases. The group work will also explore the challenges and opportunities in the transition. And finally, we'll be concluding and wrapping up. So this will make for a very interesting session. With that introduction, I would now like to invite Steph to take us through the background and contextualize the session a bit. Steph, you have the floor.
Thank you very much, Betty, for the introduction and the setup of the session. And as you see, we will do group work, and I'm very glad to see that the room is filling up a little bit more so that we have a good quotient for the group work. Yeah, a little bit of the background to this. Really, the starting point is that we have all been working with systems approaches. Many of us have been doing that, but we recognize that the system needs to be quite different if we talk about providing basic services from what is required to provide safely managed services. I think the end of this session before really spoke to that already. And really the system will need to change across all the building blocks. And it has to do with monitoring will need to be different. Regulation will probably need to be a bit more enhanced. The service delivery models will be different. And so the system as such needs to evolve as the sector moves from the provision of basic to safely managed services. We also recognize that countries are in various stages of transitioning the system. In some countries, safely managed services is the norm, is the standard to which everyone aspires, whereas in others, traditionally the focus has been first get everyone on a basic level, but with the ambition then to grow further to safely managed services. And we see that that transition is also driven from multiple levels. It starts with citizens, more and more demanding higher levels of service, not wanting to walk to fetch water, but having water on premise, having better quality water, having water 24/7. It's also that service providers are often drivers of that. And many utilities would like to have more of their customers directly connected. It generates more revenue, increases the financial sustainability of the service providers. Similarly, service providers in the sanitation value chain would like to have more and more people growing to higher levels of services. And finally, that transition is driven by governments who set ambitious goals. What we will hear in one of the cases from India, it's probably the most well-known, the Jal Jeevan mission to bring piped water supply to all the households. But similarly, there are many other governments who have made these commitments now to safely managed services. And whereas that transition provides lots of opportunities, there are also some critical concerns around equity and inclusion. If we drive towards higher levels of service, Are we not leaving behind some of the more remote rural areas? Aren't we investing in higher levels for some, whilst not even be able to provide for others? And so there's a couple of really fundamental questions that this transition provides. And as a sector, we need to discuss how can we now manage that transition? How can we manage it effectively so that any adverse effects on, for example, equity and inclusion are minimal? But also, where can we accelerate that transition? If we see good examples, how can we speed that up? And as the Wash System for Health program, we try to bring some of the conceptual and practical insights from that transition together. We're working on a learning note, and this session is a milestone in that process where we try to share our initial conceptual understanding, but really invite you as participants to bring your practical experiences, your conceptual insights, so we can enrich that learning brief for the sector. And let me start with some of the key concepts that we are exploring in that. First of all, we say that what we were saying, that in order to get to climbing that ladder towards safely managed services, the system that we all know with the building blocks, that needs to change, that needs to evolve. But also as we go, and that's an iterative process, the system gets stronger or evolves, so that higher levels of services are being provided. But by providing higher levels of services, new demands are placed on the system. And so that will be a bit of an iterative process. And that iterative process is driven by the actors that I just mentioned, users demanding that, service providers making strides to that, and governments committing to that. But underlying that, there are many other factors. It's often driven by demographic change, populations getting richer, technological change. I think we will hear also how solar power, for example, is a key factor in that transition. And there will be other underlying factors behind what actors are driving. And that's quite conceptual, but also then we need to say, okay, what does it really mean in reality? And within the learning paper, we have elaborated a number of kind of trajectories for how that transition is taking place, depending on what is your starting level of service and which are the unmet factors. It makes a big difference on whether you're already connected to a pipe supply, but water quality is missing. Then probably the change to safely managed services is a much smaller one than where you may be getting water from a hand pump, and where really a number of factors need to change in order to get to safely managed services. Or whether we are, what Lars in the previous session was saying, if you have dry pits, not in the shallow groundwater, then it's relatively easy to get to safely managed sanitation. But if you're in a densely populated city with a pit latrine, then getting to safely managed services will require changes along the entire value chain. So we have been trying to identify a number of typical trajectories for different combinations of starting points and settings, because those trajectories then allow us to identify where are the drivers of change and what types of system interventions are there to accelerate that change. And we have identified 5, 6 different trajectories. I'm just going to show 2 of those to you. These are illustrative and quite conceptual, but a number more of these trajectories have been identified. And the first one is where you start with basically unimproved wells, unimproved household supply, where people may have their own unprotected well. Then you can have supply side measures that are around technical and financial support, but also demand side measures, campaigns for well improvement or well protection. Then households upgrades to technologies considered improved, basically a protected well, for example, or a protected spring. And then you have basic services. You have an improved household supply on premise, so it is considered basic. So what is now interesting for us for this session is how then do you move forward? It could be that you start tracking water quality. I think in some of the sessions we heard today from the US, it's about that. How do you go around water quality, water safety planning for private wells? And there may again be demand side measures around awareness raising. And if that water is really regularly tested, you have water on premise, good quality, ensured available, and then according to JNP, it's called considered safely managed. You may also have other trajectories where you then say, well, actually, you want to move away from lots of private wells. And there may be, in some countries, like for example, in France, there is legislation that obliges you to connect. If there is a pipe system in your neighborhood, you're obliged to connect to that pipes, to that public supply. There may be developments of communal water supply infrastructure. And again, many users actually prefer to be connected rather than have a private well. And then you have a different trajectory. You connect to a communal supply, and again, you have safely managed. So you see that depending on what your starting points on and what systems interventions are taken, different routes to get to safely managed. We elaborated on a similar trajectory for household sanitation. Start with an unimproved pit. With technical support, with campaigns, you can work on sanitation, upgrading. I think that we all know from all the post-CLTS kind of work, technical support. But now we have an improved toilet. How do we get then to safely manage? The first trajectory is the one that was talked about in the previous session, where you'll have dry pit latrines in a safe environment, for an environment that's appropriate for in situ disposal. Then it's pretty easy. If not, then you may need to have septic tanks. Then you get into the whole work that is being done in fecal sludge management, working along the sanitation value chain with pit emptying, setting up the markets for that. Quite a number of systems interventions that we have heard in the sessions today, and eventually getting to safely managed. So again, different trajectories to eventually get to safely managed, depending on context and depending on which factors need to be approved. So we have elaborated a number of these trajectories, and what we then saw is a number of drivers and system strategies to enable, to accelerate and manage that transition. Really, one of the key ones is vision, setting targets, and leadership. You can do all of that for 1 or 2 villages, but if you really want to drive this as a strategy for a country, you need to have a vision, target for where do we want to be as a country, what do we consider really the level of service that we want to have. And I think we will hear some cases where that political leadership drove that. It's also then, again, building on some of the previous session, it's prioritizing segments or settings and looking for interrelation. And it's nice that we can now build on the session we had earlier on area-wide approaches or area-wide systems, because that also allows for lots of synergies. If you have lots of private wells, but in the vicinity of an urban area, there's maybe scope for expanding the area of utilities and making household connections. And so you can have different trajectories that overlap and where there are synergies. Certainly, very clearly, demand-side measures and responding to the demand. We see there's a particularly strong demand in the water sector for moving towards household connections. There's a big trend happening around that. Also, to some extent, a demand for having water 24/7. Water quality tends to be less of a driver of demand, but really household connections having water on premise or very close to premise is a key driver, but that needs to then be streamlined. We see cases, for example, in peri-urban areas where people connect one by one by one. That is not a very efficient way of doing it, but where you work through campaigns to connect a whole neighborhood. There, a utility can make faster advances towards higher level services. Similarly, with measures that facilitate paying connection fees and so on are other good examples of that. Legislative, normative, and regulatory measures. I think in the keynote we heard from the EPA how they have used certain regulatory measures on that, and sometimes that's obligations connect. It's also compliance with technical norms and standards for what a private well or a household toilet needs to comply with. But you have also legislative and normative and regulatory measures towards the service providers, setting service level standards, benchmarks, and enforcing these. Technical support measures, I think that speaks for itself, particularly where it's for on-site water or on-site sanitation, but also technical support for service providers and private operators along the sanitation value chain, financial measures, and finally, where we have gotten a little bit less, are measures aimed at equity and inclusion. I think that's still a little bit of blind spot in that transition, and where I hope that also during the session today, we can get more specific measures that as part of that transition, how can we make sure that we're leaving no one behind? And so that is the conceptual part. Now we're going to move to the second part, which is the practicalities. So what we will do, we will hear 5 one-minute pitches from 5 different cases. And after the cases, I will ask you to join one of these groups, and there you can discuss a bit more in detail what did that transition entail, and what were some of the challenges, the opportunities identified in that. And in that, bring in also your own experiences from similar cases. I think the cases we will hear will, of course, stand on their own, but I think they also will resonate with the experience from elsewhere. And I will introduce the pitches, the ones who give the pitch a bit later, but in your group work, you will then discuss what were some of the original challenges in moving from basic to safely managed services. What systemic interventions were being done or are being done in these cases to make that? Are there more demand side measures? Are there supply side measures? Which of the building blocks are being addressed? What or who drives this? Is it coming from citizens? Is it coming from government, from all sides? And what are some of the remaining challenges, including around gender equity and social inclusion? And so these are the kind of questions we would like you to discuss along the pitches. But now to hear what these are about, I'm going to call on the 5 case owners to briefly come forward, and you give your 1-minute pitch and hopefully get lots of people coming to your group. The first one I would like to call to the front is Bruce Umunkonda from Waterfront People, who will talk around the design and construction guidelines for emptyable latrines in low-income countries, particularly Rwanda. And you've got 1 minute.
A very difficult task. Yes, to be quick and to make sure in 1 minute, Water for People is supporting communities and the government to ensure safely managed sanitation access. So we've been supporting the communities to have fecal swab treatment plants. We've been supporting private operators in pit emptying facilities, and we've been supporting household latrines improvements. So all the conditions are in place. But recently, the private operator, maybe let's say sanitation company, came to us and say, I've managed to secure a truck, an emptying truck. I can see the DFAS is there, but I have a problem. I'm not being able to empty the toilet. So if you want to hear more, come to our group. Thank you.
Well, that was in 35 seconds, Bruce. Okay, the next case will be from Uganda, so by Yvonne Lugali, also working for Water for People. So we will have fierce competition between the 2 Water for People who will attract most people to.
Okay, great. So in rural areas, a lot of times we talk a lot about access. Do you have a source at a village level? So now being able to transition those types of people and that mentality to actually move towards piped water supply systems, to move towards being able to actually pay for their water and what that entails, but also shifting the focus away from the communities, but then also being able to know that you're handing over these systems to utilities, and how does that work? So if you want to know more, please join our group. Thank you.
Wow, that was even faster. 34 seconds. Good, Jerry, can you beat that? So the third case is from my colleague Jared Baya Atengam from IRC in Ghana.
Yes, so in Ghana, IRC have also been working with the local government authorities, the National Development Planning Commission, and the Regional Coordinating Council to implement a district-wide approach in Stephen of district, which has since been replicated. We prepared a WASH master plan to provide the overall vision. We realize we are at a target of 30% by 2030, but so far the progress has been slow. So we're trying to identify what are the key drivers, what are the bottlenecks that has been slowing down the progress towards achieving these safely managed targets. So if you want to know more about what we are finding from, from our work, City North District in Ghana, please join my group, and then we can explore together.
Nice.
Okay. Thank you. So I think that's nice. It's not only to share, but I think this is your opportunity to help Jerry to overcome the barriers in ICTP North. Now we will go to probably the biggest program in the world around safely managed services, presented by Spurti Kolipaka from University of Leeds.
Hi everyone, I'm Spurti. I'm a third year PhD student at Leeds, and with me is Ranjita, who's a final year PhD student at Cranfield. We're both part of WaterWiser. Although both of us have been briefly associated with the Jal Jeevan mission policy and rollout, we are in the capacity of researchers today. Speaking of Jal Jeevan mission or Water for Life mission, 161 million households, $51 billion in 5 years. Yes, there was political will. Yes, there was finances, but this is just 5 years. We've all heard about WHO guidelines and indicators everywhere, but nationally, we're also developing our very own guidelines through a very intense process. We really want to share and also listen more about what's happening in your country. So please join the crew.
Nice.
Thank you.
Very cool.
Great. And the numbers are really mind-blowing. So then finally, from a very big country to a very small country, we will go to the Gambia, where Self-Help Africa is working on that transition, amongst others, through the use of solar power technology as one of the enabling factors. But as will probably explain, many other enabling factors and challenges.
In about 20 seconds, right? So
1 minute.
so sometimes small is beautiful, right? So Gambia is a very small country, but a very complicated country. I don't know if you've ever been to Gambia. If you want to learn about Gambia, it's a beautiful place, wonderful beaches, ecotourism, and a crazy wash sector. So there's been a massive shift from hand pumps to solar powered piped water schemes. It's now at 76% rural piped water access, but only 12% safely managed in rural areas, despite a massive demand. We're introducing a area-wide, professionalized rural water service delivery model in the context to raise the safely managed services, but there's a lot of challenges that are very systemic. So if you want to help us to go through that journey and join us on the beaches, please do. Thanks.
Okay. Well, I think they're all very tempting cases. I don't know yet where I will be going to, but I would like to invite Bruce to pick, say, the first row, then Yvonne maybe the third row, Jerry the fifth, Spurti to the back, and then Will at the final row. And then I would like to ask everyone else, all the participants, to join one of the groups, and then you have 20-25 minutes to discuss these questions. And each of the case owners will provide a little bit more detail, but then very quickly go into the discussion, and yeah, also bring in your own experiences. And I should also acknowledge Vivine Tuizere, who is also here working with Bruce and many others who know about these cases. So please organize yourselves and have a fruitful discussion.
Thank you. Is this yours?
Sorry. Yeah.
So, yeah, thank you. Go beyond the people on the front.
Jerry,
Also that somebody there.
Jerry, maybe so what, Jerry?
You want to here, we have I'll try to clarify. So, yeah, we have established, components of the sanitation. We have, disposal, we have, empty, we have the private operator, where it is, on the other hand, we have also. So, everything was.
State government has demanded the constitutional. Has the responsibility. Why do you make a big cow? Like we have rocky ground.
Yeah.
Gonna collapse.
So that means we did everything, but we did not consider the household. So not only the toilet, but
Planning.
that's which will be handled, yes. And it will be contaminated. And all the. So then we start.
What's the water table? How do you water table?
It varies, sometimes can be 10 meters, 10 meters. The other big problem is because of the building size of it, it can be on the hills and the income.
Yeah.
Someone lives in there. And, yeah, of course, we haven't had. So we started with government. All things we have invested in. And we never accept demand. We have the facilities, we have the private investors, but if we don't have people empty their places, we look at one. So what we did, maybe for my colleague to.
But I mean, technically, if it doesn't need emptying, then it classes as safely managed unless, but with the water table, so if you look at, if you're looking at the fecal, flow diagrams, there's a whole section on where is your water table relative to your filtry, so if you had really deep water table, that scenario would be fine, that would be like, great, you know, that's how it works. But yeah, the challenge is not the lack of emptying, the challenge is the deconstruction, right?
All the things are online. There's no. They're all online. Yeah, they're all online.
So maybe
Yes, good point.
can explain to you how we address that solution and then.
Yeah, talking about the water table, we have it now in our tool that we have to get up to the point where the rich water. That's where
Or the hard rock, where you can no longer.
you can no longer. That how should be a very good appropriate for. So we kind of seated and designed the toilet really showing that at least the deepest should be 6 meters. Depending on the areas that should be deepest, but the appropriate should be 3 meters. And should be also lines, and we did it in a way that the toilet will be really affordable to the community and also attractive.
That creates a kind of.
Then we proceeded with the local lessons. Many of the local because they don't understand the rationale behind having a kind of toilet and that and then we go to them and we also have the local lessons because they are the ones. And then we, that was in the showing how much it costs to the and we started to make the low income And many don't know even they are living in informal settings where it's not really easy to get when you're and so continuing on the concept of not looking at
Okay, can I ask you about the beneficiaries? The people undertook 20 metre deep machines, those are really expensive, right? I mean, that's like digging a well. So how can they afford to put them so deep?
Yeah, but in addition to the several times, like they invest their own time.
Yeah.
Labor is cheap. Labor is cheap. Getting people to bid for you, that expensive.
Yeah, but you have like a rig check under your waist, you can pull you out. That's how you do it. Okay.
The well test, like, well reading techniques, it's the same, right?
So are they like big, like wide as well? Or are they
One meter, 2 meter, 2 meter, maximum.
It's like just a slab, so it's like a well with a slab over the top.
Yeah.
Okay. Super dangerous as well.
Yeah.
That's dangerous, there's one person at the bottom, hitting the ground and filling the soil up. And then
Exactly.
there's another one who is helping.
Yeah.
2 weeks. It will take 2 weeks. You pay them $5 per day.
Yeah.
Yeah, you do it once, you don't have to do it again.
So,
But then you are supposed to.
yeah.
Yeah, I get it from the house. Yeah, I'm not saying it should be done.
Well, if they lined it up, that would be good.
Yeah.
We didn't only stop on the POQs
And the container.
also addressed, which is maybe the second bullet, which building was. The regulations.
Yeah. We want to open the government to there is making the guidelines on how to construct it. And also support the government to the community organization. Because we just came up with the kind of toilet that is really good. In their mind, they are having that I have to toilet. I will no longer need other money to empty. So it's kind of we need to make people understand that we no longer need those toilets. Now we are starting to that the emptying so that they have to understand. Then also the government has been taking those guidelines to negotiations and supporting research using very easy messages. Further that you are having these problems because of this. And also making not only showing the health impact they are getting from even the environment, but also showing the money they are using when they are taking calculating in terms of money, not disease only there. So we support the guidelines and also we work with the operators that are doing the so we try they need to be informed. No matter anything. So then we separated more
Yeah, you don't get an empty thinking out 90 meters.
Yeah, it will never be empty, and the practice will be. This toilet is 1, 2, whatever we do. They'll have 100 years.
But if it's the households that are doing the digging, then regulating them is really hard. Regulating what people do in the privacy of their own homes. It's really hard compared to sort of saying like this is the toilet mason. And you know, we're gonna train him and his team for 30 years. Rather than like regulating people's households.
Yeah, they will definitely come to the law. When it is primarily they do the house will not be able to. So hire someone.
You said that you have developed a guideline, technical standard.
You finished.
So who is responsible for change?
and really responsible for quality application.
So for the training, we are the ones that. How many?
They need, how many meses have been trained? So what's the drop off?
So we don't have the counterpart. And then the lowest level is. And then after the village. So we do have a master at each level. That is, and again, we are together with the local authorities. They are also trained because they are the ones that will determine the construction quality. So they will be the one to support the so we turned up to 170. It was in there.
And how are people responding so far to the, you talked about behaviour change communication, messaging, like how are people responding to this?
Well, we did it last year and it's really at the beginning. People are starting to understand, people to understand it's really a long process because we've been using the radio, we've been using meetings with the community, demonstrative illustrations. And yes, but some people started to understand, mainly in some formal, not really very formal, but formal places. They started to understand because we no longer have space. If my toilet is full, because sometimes they are not only putting the physics, but also some rainwater. At some point, the system will be different. So some people started to understand that they are starting to use those toilets without thinking that maybe they have to dig my everyone.
In terms of just in terms of actual space, so is it the households that have these ginormous well toilet penetrating things? So that's what households we have that, not like in communities. That's a big amount of space for a toilet, right? And then it seems like.
And then they move it.
Yeah, and then they move it, they have to. So is there in the, like, I can't remember with Gali, but is there space, like, or the house is close? That is going up, so there is.
Smaller population.
Is it like a issue of connecting, or are they still far enough away from each other?
No, that's connectivity because sometimes, how you call, humidity on the walls.
Yeah, okay, yeah, like condensation and
Yeah,
stuff.
see your wall becomes wet, and then like, where is this water coming from? Because I need proper construction. There in the space, and there was no water. But all of a sudden, 3 years later, your walls coming wet. So we are suspecting that some of those toilets upstream might be infiltrating and maybe getting underground.
What's so the groundwater is used, well used?
Sorry?
The groundwater is used, Gali?
No, we have springs.
Yeah.
At the bottom of the valley.
Okay.
And some of those springs, actually, the water quality assessment indicated that 90% have issues in equal.
And how are they used untreated or are they going?
No, they are treated because that's nothing.
But they can be treated later. But
I recommended boiling water.
okay. But it's not like a utility supply.
No, but that's not the common water supply. You guys want to get the water utility.
Yeah.
Provide water to the taps and everything, but there are informal people that say instead of paying the water to the
They just
utility.
need, they'll use the thing, yeah.
Usually, like you also have septic tank, right? 55-60%.
Those are the medium houses.
We are discussing only about these big lectures, I know big lectures. But are you getting the empty demand from the septic tank?
Yes, that's the demand is there, and that's why it's working. Okay, because they don't have to dig and it's being empty as usual. So it's taking time. But those others, they are not empty. They're like, how come We have never received a report or a house being emptied from that period. We have to go and search what is happening for that day. And we eventually go and-
But then at least like at the high income.
Or maybe we should, maybe. Because that, one of the other point is that.
As long as you have a very good conversation.
What I was going to say, but at least like the kind of prestigious toilets is like is a shallow toilet, right? It's as well though, right? So you have like the septic tanks being the kind of high income prestigious and painful. So that's the thing, I guess.
Right, we need to separately manage for everyone.
Yeah.
We should also look at those.
Low income community.
I was more thinking about the behavior change. Like you have a group that where you can say, you know, if you want to be like these prestigious, more prestigious group, then you could use that. That's all I was thinking. Sorry, you can.
Yeah, no, I just maybe wanted to continue the point about the design of the toilet and making it affordable and attractive as well. I think with the less space and the products like Sato, I think you guys know Sato.
Yes.
In Kenya, at least, and in West Africa, there is a trend towards now that the toilet is has no smell and it's more attractive. I can get the toilet in the house to not having the toilet outside, but rather having the toilet as part of the house, attached to the house. So this provides this convenience. I can easily go to the toilet at night, or for people who have disabilities, it's easy to use the toilet and so on. And so the trend at least is like get the toilet closer to the house or attach to the house inside the house and get them a separate offset pit. So with Sato and an offset pit that is not so deep, it becomes quite attractive.
We have the one that's those medium income people. They have a toilet inside the house, flush toilet, the septic tank. That one is not. But for people low income areas, most of the time we can't because most of them don't even have water. And the supper pants, we haven't tried that within the house and the supper pan because of the smells and the supper pan have reduced. We're also facing challenges with the supper pan. The acceptability of the supper pan. People are saying when I go and use the supper pan, it's not easy to clean.
Yeah, we have the same thing in Madagascar. People just like literally look at this.
So it's not it's rather creating problems than when I say okay, as an adult I can require a lot of effort to clean it, but it's not automatically West are not and the kids will come and do no one maybe they have the old person will sit in the evening and maybe it's late. So Sato fans we are trying to study how can we maybe improve the hygienic condition of the Sato. Yes, the government has a vision to income into transit. Everything can be emptied and it's the wrong place.
In terms of cost, how much does it cost to yeah, how much does it cost to dig the pit latrine as it is, and I guess make it time compared to how much it would cost to, I'm assuming a smaller one would be much cheaper, but then how does that compare to empty and how people normally empty? They're like, I'm assuming you probably looked at some kind of the cost side of that.
Looking at the traditional because you couldn't even materials you've been using,
donors to 300. Yes, and this type of, they can go from 800 up to 200, depending on, it's similar.
And then the cost of it, yeah.
So the cost of emptying on top of that, there are new regulations that the government will be adding little subsidies, but also there's a bill of emptying that will be costed on the water consumption.
So there's it's ongoing.
Yes.
John wants to promise the one here.
Yes.
Two more minutes.
But still, it's learning.
Regulate and we know people are not paying emptying services. And we don't want people illegally emptying at night or when it's raining. How can we remove that? It's like WASA, our national utility, is going to work with pitch NPRs to give them area for and then you should show me how many people you have emptied, and you should bring me the bill, and I will be paying them. And WhatsApp is already issuing water, and I'm going to say, okay, the only way to collect that expense is through the water tariff. Because people are already paying. So if we have maybe $5, $1 per cubic meter, let's maybe add 1.5 cents. Then that 1.5 cents is for sanitation services.
And then it's free at point of use.
Yeah, if your toilet is full,
Yeah.
you just call the operator.
And they come and empty.
Empty
Yeah.
for free of charge.
Free at
But-
point of use.
Yes.
Free of charge. But that's genius.
But it's not yet there. It's not yet there.
No.
It's in the pipeline.
You need to ask for that
Okay. Our 55 minutes are nearly. Okay, no. Report that or move TV?
1 minute.
1 minute, 1 more minute.
Is that blocking that is back? When you were saying like the same but if you put certain new toilet, then you have to empty it every year. And basically, like,
Oh, yeah.
good, like, would I go there, again, I have to, they are creating business for themselves, that's how.
Okay, I really have to stop the sanitation group. But of course, that after this, there will be much more time. And because you sit in front, I would like to invite a few highlights from the sanitation group. Whilst we all get back together. And I think over here we have because then also our online participants can hear. Bruce or Vivi, Bruce, what were just a few highlights? Did you address the questions? No, okay, good.
What's that? So, but, maybe to share with others, we stopped at the pitch, we want to share the problem. What was the problem? Why the pit emptier was not emptying the toilet is because, he was going to empty the toilet, but the toilet were 20 meters deep. And therefore, they will be full maybe in 50 years or 100 years. So we need to find a solution because everything is there. The pit emptying, the company is going there, but the toilet cannot be emptied. So what we did is that we worked with the government to address that situation by establishing guidelines and regulations to avoid people not exceeding at least 6-meter toilet deep. So the building blocks we are addressing is regulation. And what drives the observation is that not only the toilet were not being emptied and will never be full, but they were also contaminating the underground water. And because of even the topographic condition, a toilet can be located on the top of the hill, but contaminating a household that is maybe 20 meters down. So it is not, it is still under implementation. We don't have result, we only have the guidelines and the regulations and the drawings and the BOQ. We have also conducted community awareness and training of masons. And yeah, we've had cases from other countries, Tanzania, Kenya, share that now they are considering of incorporating the toilet in-house with a subtle pan, so that even if a house do not have a flush toilet or water connected, they can still use a subtle pan to have a toilet in-house, and that will reduce maybe the burden of waiting outside during the night for a toilet. And we will also share an example from Zambia, where because this case that we presented is mostly for low-income countries, communities, low-income communities, and the middle income houses do not have this because they have septic tanks. So we shared another example where we are discussing with the government, which is trying to introduce a new sanitation bill through water bill. So that means when you are paying your water bill, at the same time you are paying your sanitation services. And therefore a private operator will come empty your toilet for free, and you will be charged through your water bill, and you will get payment by the national water utility. So we got example from Zambia how they are doing it, and because it's not that easy, and population can be sometimes be hesitant to do that. We didn't discuss the gender and social inclusion. It's very hard, but yeah, colleagues, if I missed.
Good, so interesting, the different building blocks, the regulatory one, I think is a very clear one, but also the financial mechanisms are clear, the technical norms and standards as part of the regulation. Good, then we go, I think, to Will. Where's because in the end, the groups from Gambia, Ghana, and Uganda, the three cases came together and explored commonalities and differences between three rural water cases. So Will, what transpired?
Right, so well, I mean, Gambia was too small to be the name for us, so we brought in the big brothers of Uganda and Ghana. And it's a really interesting mix of very different service delivery model contexts, where you have like Uganda with rural utility or utility outreach to more organically incubated local service delivery models. Also very different set of contexts in terms of sector maturity, coordination, area-wide planning. So one key thing that came up that you coined well, Steph, was around the drivers in terms of bottom-up or top-down. Is the kind of transition to safely managed and household connections for water driven primarily by household demands? Or is it driven primarily by kind of top-down government policy, or is it somewhere in between? There was some interesting learning kind of around that. So obviously with the top-down stuff, political will, utility growth and extension, those are some of the drivers on top-down. With the demand side, it's there, but what was really interesting is how to create demand and willingness to pay for that increased level of service, where you have alternative connections. And there was some interesting examples around kind of developing the value proposition and getting customers to really see the benefits of going for safely managed services over alternatives to packed water. There was some of the enablers around kind of area-wide plans and area-wide strategies to create that kind of harmonious, clear market condition for these services to grow, and the value of where it's kind of more organic growth, having demonstrations and pilots to show people how it can be done. And yeah, there was some points around self-supply being not only an ability to create ability to pay for household connections, or as a complementary approach where communal services are less viable. I'm not sure if I missed anything, but otherwise I'll to the next group.
Okay, great. And nice to see that some of the drivers that we had also identified more conceptually are there, but sometimes also as a kind of a double-edged sword, particularly around the demand, what you were explaining from Gambia, where there's so much demand that it also leads to certain chaos and uncoordinated efforts. Now we go finally to Jal Jivan, to India, Spurti.
Sorry.
Exactly.
Thank you. Well, considering the scale of Jal Jeevan mission, we did touch upon most of the building blocks. We did talk about financial measures. We spoke about the institutional mechanisms. We spent a lot of time discussing how the hell do we do planning in the first year. But it was also interesting that, I mean, considering no matter there's a financial commitment, there is a political will. It is not perfect anywhere. We still have a long way to go. But the conversations, we also addressed like the bottlenecks and the gaps. But the good thing was we were following the system strengthening approach somewhere. So the solutions more or less were again around building those systems. I mean, none of it is perfect, but somewhere we're getting there, I think. That is what I got from our conversation.
And were there also any other cases presented in your group that have similar initiatives or efforts going on?
So Leeds is from Brazil, and she was sharing some examples from her country as well. Do you want to add? Yeah, yeah, you can.
Please use the microphone for the online followers. Sorry.
Yeah, I'm Leeds from the University of Leeds as well. I'm close friends with sports, but I've never heard about what the amazing work she did in India, which is, yeah, curious. But in Brazil, we also have federal, state, and local levels of governance. And we also had in the past, like, projects that were quite sudden, so a huge amount of money is suddenly being injected in the sector, and then the national and state like levels and local levels having to organize really quickly to then, you know, plan something that would have taken maybe 5 years to planning in 6 months. Deeply in unequal states. So because it's a huge country, the same as India, so they faced quite like a lot of challenges with, they had some rule, if I understood correctly, that when the national government was investing, the state government had to invest the same amount. But obviously some states didn't have the capacity, so it was something that they had to fight and yeah, be liaise and organize with them and kind of to make sure the states would be included as well. And something very similar as well in Brazil with the PAC, which is Program of Acceleration and Development. So yeah, since 2009, this program has started in Brazil, and it was when the sector like did huge, you know, progress, and we had similar issues. I think there is a lot that we can learn from the Indian government for sure.
Okay, good, interesting similarities between two federal states with large government-driven programs towards safely managed. Good, thanks for the feedback, and now over to Sporty for the closure remarks.
Thank you so much for joining. We were actually quite apprehensive of how many return of considering the competition we had. So really grateful that you showed up. And thank you, Steph and Betty as well, for facilitating this. So there's going to be two things following from the session. First, all our discussions are going to go towards the learning paper that's being produced by staff and Paul and team. The second thing which I'm very excited about is they're also trying to build a wash systems academy course from this discussions and learnings, and some of the previous courses have proven to be quite helpful for many stakeholders out there. So do watch the space and let's keep in touch. Thank you.
Okay, thank you.